Thanks for watching France 24. Now we're just minutes after a press conference by the Prime Minister Jean Castex. He was speaking about the fifth wave of the Delta variant of Covid-19 not being over yet. This while the Omicron variant is rising rapidly. 100,000 cases, that landmark figure reached in recent days. We're seeing the highest numbers at the moment since the beginning of the pandemic. So lots of announcements made this evening. Nothing as dramatic as might have been feared. No curfew announced for the 31st of December, for example. Schools reopening as planned on the 3rd of January. Also the duration of a new quarantine for contact cases. That will be announced by the end of the week. One of the big announcements, we'll give you that in a moment. But just let's take a listen first to the state of play as announced earlier by Jean Castex.
The 7-day trend for new daily cases is now more than 70,000. The national incidence rate is now above 700 per 100,000 people, the highest it has been since the beginning of the health crisis. In our healthcare establishments, the hospitalization rate is rising. The situation remains particularly tense. Firstly, because workers are exhausted, and also because other illnesses are strongly affecting the level of activity.
Now, a series of minor measures announced in that press conference this evening. For example, no more standing in bars and restaurants. Customers will have to sit down, but perhaps the most significant measure announced this evening, the already controversial pass required to get into bars and restaurants, is to be tweaked. Let's take a listen to what Jean Castex said.
Le Conseil des ministres d'aujourd'hui.
Monday's cabinet meeting adopted a bill that will transform the health pass into a vaccine pass. This means that in places where this pass is required, you must prove that you are vaccinated to be able to enter. Providing a negative test will no longer be enough. This new rule, if voted by Parliament, will apply from January the 15th next year.
So probably the major announcement of the evening there by Jean Castex. The vaccine pass will require vaccination. Rather, negative tests will no longer suffice to enter public places. Those measures taking effect from the 15th of January. To discuss all of that, we're joined now by Martin McKee, Professor of European Public Health at the London School of Hygiene and Tropical Medicine. Thank you for talking to us this evening. I presume you've been listening in to some of those measures announced by Jean Castex. What do you think of them?
Yes, I have. I suppose my sense was it's a little bit like what's been happening, or rather not happening, here in the United Kingdom, which is that we really are facing a crisis, and it's not entirely clear that the seriousness of that crisis has been fully grasped. We will be getting an announcement on Friday about additional measures, but I think that we really don't have a lot of time given the rate with which this variant is increasing.
So measures taken in the Netherlands and Austria where they've introduced lockdowns, from your medical perspective, is that preferable?
Well, we can just look at the data. And both of those countries have turned their curves round. So they were going up very rapidly, and now they've been bringing the cases down. But of course, that was with the Delta variant. The Omicron variant is much more transmissible. So we do need to see what will happen going ahead. But it is very clear that those restrictions are effective. So therefore, when you're getting very rapidly rising cases, I think there's a very strong argument for looking at that, given the crisis. And I think in particular, a point that was made by Mr. Castex and by Mr. Véran was the pressure that is being placed on essential services because so many people are ill, and therefore the ability to respond to the crisis. Health workers, people in other essential services, that's really the challenge at the minute, as we do have these discussions about how severe this variant is.
And just looking forward to 2022, the third year of this pandemic, I think so many people weary from the ongoing concern about how to manage this. What of the necessary balance going forward, Martin McKee, that has to be struck 2 years into this pandemic between life going on and precautions being taken. How do you see 2022 playing out? For example, will treatments begin to become a more central focus as well as vaccination? Could that change how the management of the pandemic is handled in terms of lockdowns or measures such as that?
Well, advances in vaccination and vaccine technology and in treatment are clearly very important. But the idea that there's a balance to be achieved here, I worry about that, because what we have seen in a number of countries, the UK being a good example, or England, I should say, of trying to, and the terminology is to live with the virus. People have tried to do that by removing the restrictions. But the reality of it is that people are still getting ill. The virus is not paying any attention to that. So we can say that people can go to football matches or go to the theatre if the football teams are not themselves infected or if the actors are not themselves affected. There's no restrictions there, but you simply can't do it because the infections are at a high level. So it's not a balance. It's actually about bringing cases down to as low a level as possible and doing all of the things that we know work, and in particular making the environments much safer with air filtration, ventilation in particular.
Martin McKee, thank you for those insights.
Thank you.